So thank you all so much for being here. I'm Dr. Val Arkush, and I serve as the Secretary of the Pennsylvania Department of Human Services. And it's my honor to welcome all of you here today to join us as we recognize Suicide Prevention Month and Suicide Prevention Awareness Day here at the Capitol. I especially want to thank my fellow cabinet secretaries and Shapiro administration leadership who are joining us today, and you'll be hearing from all of them shortly. And also want to acknowledge Department of Aging Secretary Jason Kavulich and members of the Governor's Advisory Commissions that are here today. So today is about honoring survivors, remembering those we have lost to suicide, and crucially, talking about the resources available to help those in crisis and save lives. My Department of Human Services team and I are proud to be with our fellow state agencies, standing here with me and all the folks that are around this rotunda, providing information and education specific to those that we serve and those who are most at risk for suicide, including veterans, older Pennsylvanians, members of the LGBTQ+ community, and so many others. Thoughts of suicide, self-harm, and behavioral health challenges are more common than many people realize. They can happen to an individual of any background or social identity or in any zip code. And they may be hard to spot. Think of the happiest person you know. Outwardly, they may appear like everything is just going great, but we just don't know what could be going on inside. According to the latest data from the Pennsylvania Department of Health, 1,925 people died by suicide in Pennsylvania in 2022. It goes without saying that this is an unacceptably high number. But even one life lost to suicide is one life too many. And these numbers are not just statistics, they are real people whose deaths have ripple effects throughout their families and through entire communities. We know that survivors and loved ones affected by suicide may wrestle with unanswerable questions, complex emotions, and sometimes fears of being stigmatized and isolated if others knew about what they were experiencing themselves or how their friend or loved one died. So let's talk about what each of us can do to help ourselves, our neighbors, our friends, and our loved ones. The more we talk about it and check in with our loved ones, the more we can help people feel safe talking about what's going on beneath the surface. We must commit to making asking for help for a mental health challenge or a substance use disorder as normal as asking for help for a broken arm. I want every Pennsylvanian to know that we are making that ask for help as easy and as judgment-free as possible. Right here in Pennsylvania, we have 12 suicide and crisis lifeline call centers where trained staff answer calls when you call or text 988. When you call or text 988, you receive free and confidential help 24 hours a day, 7 days a week. You are connected to a caring and highly trained staff person who will listen, provide support, and refer you to resources in your community as you need. And if you are a veteran and choose to share that, you will be immediately connected to services specific for veterans, and we'll hear more about that in a moment. You will get no judgment, just help. Over the past few weeks, I've had the opportunity to visit 3 of these call centers, which are located across our Commonwealth. One of them is in Cumberland County, right across the bridge from where we're standing now. I was so inspired by the high level of empathy and care from the team that I met at this call center and at the others I visited across the state. In fact, in Pennsylvania, more than 90% of issues that callers are experiencing are resolved by simply talking with a trained counselor over the phone. No EMS or other intervention is needed. Staffing a 988 call center is incredibly important and often life-saving work. The Department of Human Services is so grateful for the dedication of the staff and the volunteers at these call centers across our state who are there to support our fellow Pennsylvanians 24/7. Nearly 11,000 Pennsylvanians contacted 988 in August of 2024 alone. Let me just say that again, 11,000 calls just in the month of August of this year. And 91% of those calls were answered by one of our call centers right here in Pennsylvania. This data shows how important services like this are and the tremendous and potentially life-saving impact of simply having someone immediately available to listen. I am proud to be part of this administration where Governor Shapiro prioritizes increased funding for behavioral health services throughout the Commonwealth. The 2024-25 state budget built on the previous year's budget investments by providing an additional $20 million for county behavioral health programs, $5 million for crisis stabilization walk-in centers with a focus on geographic areas that do not currently have such a center, and continuing the $100 million in mental health funding for K-12 schools. We know we've made a lot of progress in talking more openly about behavioral health and suicide and increasing funding to those doing this incredible work in our communities. However, we know there's still a lot more to do. Each of the state agencies represented here today is a member of the Suicide Prevention Task Force, which is implementing the current statewide suicide prevention plan. That plan was introduced in 2020 and is now being updated with a focus on addressing suicide prevention strategies for our most at-risk populations, including older adults, veterans, LGBTQ+ Pennsylvanians, and Black youth. Last year, Pennsylvania was selected to be one of only 8 states invited by the federal government to participate in the first ever Policy Institute on Black youth suicide prevention. Representing the Commonwealth at this Policy Institute were team members from the Departments of Human Services, Department of Health, and the Department of Education, representatives from the University of Pennsylvania, the Association of School Psychologists of Pennsylvania, the Pennsylvania School Counselors Association, and a family member with lived experience. The team received education and training and has since worked to develop strategic goals that include developing partnerships and communication plans, collecting data, and developing community and youth leaders. This work is ongoing and now includes more Commonwealth agencies and the Governor's Advisory Commission on African American Affairs to participate in goal setting and next steps. And I also want to thank Chris Finello, who is the Executive Director for the Governor's Behavioral Health Council, a group that is meeting monthly with stakeholders from all across the state to work on and prioritize these issues. These are just a few examples of how, when it comes to behavioral health, no one person, no single community group, no single agency can do this work alone. It will take all of us working together to find solutions to reduce the prevalence of suicide in Pennsylvania and providing people with the health care services and supports that they need. To share more about what other agencies are doing to prevent suicide and reduce stigma, please welcome my colleague and friend, Department of Health Secretary, Dr. Deborah Bogan.
Good morning. Thank you, Dr. Arkush, for those moving remarks. I truly appreciate the opportunity to help raise awareness of and reduce stigma associated with suicide. We do that by openly discussing suicide and suicide prevention like we're doing here today. Too many people believe that only those living with mental illness are affected by suicide. That is just not the case. People with no history of mental illness may experience complex stressors, a life event, or countless other factors that lead them to consider ending their life. My many years working as a pediatrician have taught me how important it is to ask and not assume. Our society says bringing home a new baby is supposed to be one of the happiest times in people's lives, and it often is, but it can also be very stressful and very scary. According to the CDC, about 1 in 8 women with a recent birth reported symptoms of postpartum depression, and some of these new mothers contemplate suicide and very sadly go through with it, follow through. And death from suicide is a leading cause of death in the first year postpartum. You cannot tell by looking at someone what they're feeling or thinking. You have to ask. Even after years as a clinician, I can't tell. I can't tell. That is why in the clinic where I worked for many years, and in many clinics across the Commonwealth and the country, we use a validated screening tool to assess for depression and thoughts of suicide. We talk about the screening results openly and offer referrals, sometimes urgent warm handoffs. And fortunately, we have many resources, as Dr. Arkush alluded to, both local and national, to help. For new and expecting parents who may need someone to talk to about their feelings of sadness, worry, and being overwhelmed, there's the free National Maternal Mental Health Hotline, as well as 988. Besides new parents, other groups at higher risk for death from suicide include youth, veterans, people in the LGBTQ+ communities, indigenous populations, survivors of disaster and loss, and people with disabilities. It's estimated that over 12 million American adults seriously think about suicide each year. Personally, I know that suicide can be difficult to talk about, but we need to talk about it. When my father was in his early 70s, he kept telling us he didn't feel well, and he was increasingly withdrawn and quiet, and not typical at all for my gregarious father. We were concerned for months. We kept asking him to go to his doctor, and he saw his doctor a couple times, but it became clear with time that he was really suffering from depression, and this wasn't a physical ailment per se. And one day, one of my sisters asked him if he had thoughts of hurting himself, and he openly said yes. He was so relieved, and he also told her he had a plan. He was so scared, but so relieved that somebody finally asked him about it, and he talked about it. And as a result, he received the care he needed to get better and to feel better. We were so fortunate as a family. Like many families throughout Pennsylvania, we missed some of the warning signs, and we were afraid to broach the subject, but I'm so glad we did. And I'm here with others today to encourage you to not be afraid to talk with your loved ones openly about suicide and to offer support and help. To be absolutely clear, talking about suicide does not increase thoughts of suicide or cause people to act on their thoughts. Research shows that acknowledging and talking about suicide lets people know you care. If someone you know is in need, please listen to what they're experiencing, show compassion and empathy, don't dismiss or judge, and most importantly, help them find the assistance and resources they need. In Pennsylvania, about 2,000 people die by suicide each year, and many more survive an attempt. Our goal is to lower these numbers and to help people get the support and aid they need, like my father did. One way the Department of Health is working towards that goal is through our Bureau of Health Promotion and Risk Reduction's Division of Violence and Injury Prevention Suicide Prevention Pilot Program. And you can learn more about that over at our table over there. This program, which started last year, seeks to identify and support people at risk by both reducing factors that increase risk and increasing factors that promote resilience. We are creating more resources and getting the word out about them. Mental health is as important as physical health for our overall well-being, and the two are inextricably linked. However, due to long-standing stigma, we don't easily talk about mental health challenges. Half of people who die by suicide do have a mental health condition, and about 90% have experienced symptoms of a mental health condition. If we reduce the stigma around suicide and mental health and talk freely about it without judgment, offer support and connect people, we can together save lives. When someone is in need, help is available from a variety of people and places, including healthcare providers, mental health providers, clergy, friends, and family. We also have the 988 crisis line, where trained professionals are available to listen and provide support 24/7, 365. Christmas, New Year's, every holiday, they're there. It may seem difficult to talk about, but reducing death by suicide may come down to a single person asking a caring question and then offering to help them get help. Please be there for someone in need and know there are a myriad of resources available to support you and your loved ones. Again, thank you so much for having me here today. It is now my honor to introduce Major General Mark Schindler.
Thank you, Dr. Bogan, and good morning to everyone. It's great to see so many agencies, community partners assembled here today, unified by a common goal, to raise awareness about suicide prevention. At the Department of Military and Veterans Affairs, we know how serious a problem suicide is in the veteran community. Military veterans are 1.5 times more likely to die by suicide than Americans who never served in the military. For female veterans, the risk factor is just over 2 times more likely. We stand here today to share with veterans in crisis and their loved ones key messages, to provide them with hope, optimism, and a way forward for a brighter future. Our department is quite aware that we cannot do this alone. We're grateful for all our community partners who work tireless each and every day to improve the lives of veterans and help them to feel safe. We saw evidence of how powerful we can all be together when we held our first ever VetCon in Pittsburgh last week. It was a powerful 3-day conference with nearly 400 state, local, and federal advocates who will no doubt go a long way to help veterans in crisis and veterans in general. Together, we have the power to raise awareness, to share valuable information, and ultimately, to save lives. I encourage everyone here today to reach out to a veteran, their family member, or friend, and remind that person how much you care. You see our veterans everywhere. You see them wearing hats, you see them wearing shirts, you see them rising to be recognized at sporting events, at conventions. Please reach out and not only thank that veteran for their service, but have a conversation with them. Ask them how they're doing, ask them how their loved ones are. If you're a veteran in crisis or you're concerned about one, once again, please, free confidential support is available 24/7. Call the Veterans Crisis Line by dialing 988, simply pressing 1. Thank you to all our veterans, our service members, their families for your service to Pennsylvania and our country. I'll now be followed by the Executive Director of Governor's Advisory Commission on LGBTQ+ Affairs, Ashley Strange, and Annette Nance from the Commission on African American Affairs. Thank you so much.
Hello, I'm Ashley Strange. I use they, them pronouns, and I'm the Executive Director for the Governor's Advisory Commission on LGBTQ Affairs. And I'm joined today by Dr. Annette Nance, who's the Executive Director for the Governor's Advisory Commission on African American Affairs. We're honored to be here representing the Governor to recognize Suicide Prevention Month. My mom ended her life by suicide in 2016, and the ripple effects of her passing can still be felt today in our family, in our community, and beyond. It's part of the reason why I'm so passionate about getting support to the communities that need it, because I know that I'm one of the people that needs that support.
Ashley and myself, we represent the 6 advisory commissions to the governor, and we all represent communities that are especially prone to health disparities and high rates of suicide. Queer folks, African Americans, Asian and Pacific Islanders, Latinos, women, and youth all struggle with similar needs and special care when it comes to outreach and prevention. And I'd also be remiss if I didn't mention that I'm also a Marine Corps veteran myself, so this topic also hits home in a different way as well. especially where our communities intersect, like with queer youth of color and Black youths in particular. We want to see a world where they are no longer a statistic for suicide, but a group of people who want to find and get help.
The Shapiro-Davis administration invested $200 million over the past year and a half to provide more mental health resources in our schools. We've also increased funding for county-level mental health support by $40 million during that same time. And we've taken action on mental health parity, including directing PA Insurance Commissioner Michael Humphreys to make mental health parity a true reality in Pennsylvania, to hold insurers accountable so that mental health benefits are covered fairly.
We encourage you to use the resources that are available, like 988 for mental health emergencies and simply being there for communities like our colleagues have said. Together, we can turn the tide and keep our people alive. Thank you.
Up next, we have Caroline Boehm from the Pennsylvania Insurance Department.
Good morning, everyone. Is it still morning?
We didn't start that late.
Perfect. Thank you, Ashley and Dr. Nance. Good morning. My name is Caroline Boehm, and I have the privilege of serving as the Policy Director at the Pennsylvania Insurance Department. I want to thank the Department of Human Services and Secretary Arkush for coordinating today's event and to acknowledge all the speakers here today for taking the time to highlight this important cause. Listening to the stories of those affected by these tragedies is a stark reminder that suicide can affect families all across the Commonwealth at a moment's notice, which is all the more reason to regularly check in on your loved ones and remind them it's okay to not be okay. People need to feel like they can reach out for help and promptly receive it without stigma or the worry for how they are going to afford these critical services. Affordable access to mental health and substance use disorder treatment is essential in the fight to prevent suicides. At PID, we've prioritized ensuring that insurance companies are covering mental health and substance use disorder benefits in parity with physical benefits. There should be no additional barriers or limitations to seeking mental health and substance use disorder treatment or coverage. Under Governor Shapiro's direction, we're working to hold insurers accountable so that benefits are covered fairly and provider networks meet adequacy standards. Through audits targeting insurers' compliance with parity laws, as well as our review of health insurance policies, PID continues to leave no stone unturned when it comes to protecting consumers' parity rights and access to essential treatments that can save someone's life. No one should forgo or delay mental health or substance use disorder treatment due to fear of how much assistance will cost or because they can't get an appointment with an in-network provider. At PID, we are here to be a resource for consumers. We want to help. Our dedicated consumer services staff can assist Pennsylvanians in navigating their health insurance plans and networks. Consumers can submit a complaint online at insurance.pa.gov. And if you're here in person, we have a table with physical complaint forms that you're welcome to help yourself to. We could use the public's help in identifying areas where network adequacy and parity may not be correctly implemented. So if you see, hear, or experience issues with accessing a mental health or substance use disorder provider, or you are hearing that health insurers are making it difficult to access mental health or substance use disorder services, medications, or treatments, please say something. Finally, for anyone that is currently without health insurance and needs health care coverage, Governor Shapiro has prioritized making coverage affordable and easy to obtain. Pennsylvania has a state health insurance exchange that offers subsidies based on income that help cut health insurance costs for those who qualify. Open enrollment begins November 1st, and PID highly encourages anyone who is currently uninsured to visit Pennsylvania's individual marketplace, Penny, at www.penny.com to view, compare plans, apply, and enroll in high-quality health coverage. All plans purchased through Penny must have mental health benefits that comply with parity laws. And remember, no insurance coverage is required to use 988, a free and confidential resource for anyone in crisis and looking for help. Thank you, and now I will turn over to Amanda Blue from Prevent Suicide PA.
Good morning. My name is Amanda Blue. I'm the Executive Director of Prevent Suicide PA, as well as the Education Director for the David Farber Aspire Center at Jefferson University in Philadelphia. These titles reflect my passion for both mental health and education, but the real reason I'm here today is more personal. In 2008, I was living what most people would call an ordinary life with my husband of 17 years, together raising our children, 11 and 13 at the time. My husband worked in sales. I was a graphic designer. Our kids played soccer. We were just like many other families living in suburban Philadelphia. But on March 26th, everything changed. That was the day my husband took his life. It's difficult to describe what it's like to lose a partner so suddenly and in such a devastating way. I was left to tell my children that their father was gone, but also that he died by suicide. It's hard to know which part was more painful. My husband didn't have a history of mental illness or depression. 6 months prior, he had heart surgery, a situation known to sometimes trigger depression. But there were no obvious signs. He went back to work. We thought the worst was over. For the next 3 years, my children and I worked to rebuild our lives. My daughter sought help from a therapist. My son was more reluctant. I tried therapy myself, but as a newly single mom working full-time, it didn't work into my schedule very well. We were doing our best, though none of us were the same after that day. In 2012, my daughter was preparing to graduate from high school. My son had just started a STEM high school. He'd always been a stellar student, but the transition year was difficult for him. He struggled with the adjustment and eventually agreed to see a therapist. After 4 sessions, his therapist said he could decide if he wanted to continue, and he didn't. 2 weeks later, my son took his life. He was 14 years old. It was 2 weeks before his 15th birthday. Losing a child is nothing I can describe. The grief is overwhelming and all-consuming. My son, like my husband, didn't have a mental health diagnosis, but he did have at least one important risk factor: surviving the loss of a loved one to suicide. We didn't understand at the time that that loss increased all of our risk. There's a common belief that suicide only happens to families who are struggling with mental illness or addiction or families in crisis. But I'm here to tell you that it happens to families like mine. Suicide doesn't discriminate. It crosses socioeconomic, ethnic, cultural boundaries. It can happen to anyone, anywhere. That's why it's so important to notice. To notice when we see people's behaviors shift, and to speak up. So today, I teach people about suicide prevention. I teach them how to recognize the warning signs, the risk factors, and how to intervene when you think someone might be in crisis. But the heart of what I teach people is something much simpler. It's about listening. Listening with compassion and without judgment, and then being brave enough to ask them directly, are you thinking about suicide? You can't create that thought for them, but you can open the door for them to talk about it. I'll never know what might have saved my husband or my son, but I know that every one of us can play a role in preventing suicide. So if you find yourself in a moment of uncertainty, wondering what you can do to help someone who is struggling, I hope you'll remember this. Your compassion, your willingness to listen, could be what makes the difference. You have the power to save a life, even if it's just a single conversation. Thank you.
Amanda, thank you so much for sharing that story. And just want to underscore the importance of so many of the stories that you've heard today from all of our speakers about how suicide can impact any of our lives. And really just want to remind everyone one more time about the importance of just being there, asking the question, and offering your non-judgmental help and support. I get asked a lot, what some of the other speakers talked about, is if I ask somebody if they're thinking about committing suicide, will that trigger them to do so or put that thought into their head? That is just simply not the case. As you heard today, the evidence is really clear that that might be the best way to actually help save a life. So we're really grateful for everyone to have spent some time with us today. I want to talk about the importance of that non-judgmental listening to someone who's looking for help, and to offer to call 988 or another trusted advisor or counselor with them. Just be there to stand with them during this time. There's a few other folks that I want to thank today. In addition to all of our state agencies that are here, I'd like to thank Prevent Suicide PA and the Jana Marie Foundation for being here. Prevent Suicide PA supports those who are affected by suicide, provides education, awareness, understanding by collaborating with the community to prevent suicide and reduce the stigma associated with it. The Jana Marie Foundation has a special focus on helping young people through conversations, building connections, and promoting well-being among our youth and their communities. And as we wrap up, I'm just going to say it one more time. Check in with your friends and your loved ones, particularly as the holiday season approaches. We know that this is often a time of a lot of heightened emotions and concerns. Let people know that you're there for them. Let people know that you're always available to listen without judgment. Put 988 in your phone so in a moment of urgency, you remember what those 3 digits are. And offer to just be the person that sits there while your friend or loved one makes that call for help. Together, we can make all of our communities safer. We can make every person in our communities feel more supported. And together, this is how we end suicide in the Commonwealth. Thank you.